Let's turn now to 17's Eitan Wallace, who has a closer look at the figures.
Yeah, Kern meets the state's criteria in several categories, but there's one metric where the Golden Empire misses the mark. Today, Kern Public Health reported 0 new COVID-related deaths in the Golden Empire, but cases continue to increase at a rate of more than 100 per day. New cases reported as of this morning, 124.
What we have noticed in our contact tracing is that we do have a number of people who identify non-household contacts, of people who they are in close contact with outside of their home. So we know that people are gathering.
In total, about 73,000 Kern residents have tested for COVID. Of those, about 66,000 or 92% tested negative and 5,369 tested positive. Of the positive cases, roughly 96% are either fully recovered or recovering at home. 123 residents, or 2% of those who tested positive, are currently in hospitals. Kern's 4% positivity rate meets the state's 8% goal, but Kern fails to meet the state threshold for the following category: the percentage increase of hospitalized patients over a 3-day period. The hospitalization rate in Kern has increased 18% over the last 3 days. The state's target is 10%, and that could have an impact on how long some businesses in Kern remain closed.
It's entirely possible that this will get extended even further than the next 3 weeks, depending on how we are doing in each of those categories, how we are doing as a community, as a region, as a state, on flattening and the curve and managing the spread of this virus.
Ahead on 17 News at 6, hear what county leaders say on enforcement. Reporting in Bakersfield, Eitan Wallace, 17 News.